So good evening to all of you. Please close your hands for the prayer. This is our inauguration prayer. Om Shahana Bhavatu Shahano Punaktu Shahobirjam Karuva Vahi Tejashina Bodhi Tamastu Ma Vidvishabhai. Om Shanti Shanti Shanti. Sushi, now you can start. I am giving you I am making you host.
Okay, sir.
So Sushi, now you are host.
Okay, sir. Thank you, sir. So participants, my screen is showing to all of you.
Yes, ma'am.
Okay, thank you, sir. Okay, so good afternoon to all. So heartiest welcome to all. Today we are starting our first class on of this 2-month on counseling course. So firstly, let me introduce myself to you. So my name is Shreshi Sharma. I completed my graduation and post-graduation in psychology from University of Calcutta and MPhil in clinical psychology from University of Calcutta. And currently, I'm practicing as a RCI registered clinical psychologist at private mental health clinics in Kolkata. Also, I qualified STET eligibility test, SET, that is known as a SET for lecturership of West Bengal. Also, I work as an academic assistant at RPRIT. And from today onwards, I will teach you and train you for Tele-Mental health counseling. So you will be benefited by other internal in academic faculties and our founder and president, Dr. D. Dr. Roy sir, and some external faculties. So before starting the lecture, now I would like to request all our participants to share their experience, their thoughts, their expectations from this course. And also you need to tell about yourself. Okay. So just an introductory part it is. So let's start. Okay. So, okay, Darsh, can you introduce yourself and tell me your expectations from this course?
Very good evening.
Yeah, good evening.
My name is Darshpreet Kaur, and I completed my post graduation from Jammu University. Can you hear me?
Yes, I can hear you.
So I just completed my post graduation from Jammu University. So as I get to know about this training on Tele-Mental health counseling, so I wanted to, as I'm a fresher, so I wanted to just gain knowledge more about these mental health counseling so that I could also further counsel and guide other person.
Wow, very good. So what is your expectation from us from this course?
So ma'am, I'm expecting that moreover, as you have mentioned, the whole model that what we are going to study over here. So I want that I am perfect. I just get that all knowledge of using that MS Excel PowerPoint also, that it can further guide me to make such slides and take such classes from others.
Okay, very good. Thank you. Okay.
Thank you.
Priyanka Devnath. So Ms. Priyanka Devnath, Dr. Priyanka Devnath, right? So
Yes, ma'am.
would you like to tell about yourself? already you tell yourself, Dr. Sir, but what is your expectation from this course?
Yes, good evening, ma'am.
Good evening.
Yes, ma'am. Actually, knowing human mind is a very psychology is still very beautiful subject, because when we study any other subject, there comes psychology back to back, and that's why I want to know the subject from very core part. And from this counseling, ma'am, actually, I want to help people more.
Okay.
That's it, ma'am. I know actually. I follow Sar's post in Facebook, and I am very excited to do this class, ma'am.
Okay. Okay.
Yes, yes, ma'am. Thank you.
Okay, so next, Miss Shudhipa Mojumdar, ma'am. So you are the secretary of our institute. Sir already introduced yourself. So would you like to tell us about yourself more to all other participants?
Namaskar. I am Shudipta Mujumdar. Good evening.
Good evening.
I am an ongoing student of IGNO, Masters in Psychology. And during this course, I wanted to make an internship. So I joined this internship course to complete my study.
Hello.
Yes. আসলে এই জন্যই আমি জয়েন করেছিলাম সরি
Sorry, not hear you. Sorry.
for this
Hello.
may I audible?
Yes, yes, you are.
So I joined this course for the internship program and also how counsel others, basically children's, because I am a teacher also. I work with little children, so it is very much helpful for me on future. This is my expectation.
Okay. So as an academic assistant of this course, I just want to would like to know from you what is your expectation from this course and from me also.
If, I expect that it is help to it is this course, internship course, as the internship is a mandatory part of IGNO master's program. So I want this want from this course as a this course help me to complete my study and help me to work more effectively with children.
Okay, okay, very good. Thank you. Okay, thank you all for interacting me. So, okay, let's start our first class, day 1. Okay, so just a moment. Okay, let me introduce our syllabus to you all. So we have 5 papers, right? Paper 1 is on models of mental health, where we will cover mental health outreach program and some analytical theory, psychoanalytical theory like Freudian theory, Jung theory, Erikson theory, and some developmental theory like Kohlberg, and some behavioral model will be covered like Watson theory, Skinner theory, Pavlov theory, Skinner operant conditioning, Pavlov classical conditioning. These are. And next, some cognitive model will be covered, Tolman, Piaget, and Chomsky's theory. Social theories given by Bandura, Lewin, Festinger will be covered, and humanistic theory like Roger, Maslow will also be covered, and some positive psychological theory like Seligman, Rabindranath Tagore, and some Dr. Roy's viewpoints will also be covered. And this Rabindranath Tagore approach and will be covered by our president and founder, Dr. Devdulal Dr. Roy. And next, paper 2 is on approaches of mental health counseling, where directive counseling method, non-directive counseling method, eclectic and statistical method will be covered. And paper 3 is on tele-assessment for anxiety and depressive disorder. So in this paper, you will be taught about anxiety and depressive disorder, about the concept of anxiety and depressive disorder, and next, how to take case history and mental health, mental status examination, mental health assessment, and some screening method will be covered. Paper 4 is on IEC and mental health and ethics, where you will be guided to make designs and some materials, PowerPoint for community mental health awareness and counseling, and some ethical, what are the ethical codes you should be keep in mind while assessing psychological test and report and doing the counseling sessions. Okay, each paper has 100 marks, each theory papers, and paper 5 is practical, where you have to see 10 cases. You need to take case history, MC, and some screening assessment, and you need to submit the 10 cases report. Okay, otherwise you will not be qualified for a theory program. Okay, and Viva will also be done, okay, before giving you the final certificate, because practical, because this is the training course, right? So training course, we need to see how you have developed the skills to see the cases and how to take cases free MSc and conduct assessment program. So you need to, primarily you need to submit 10 cases marks. 5% attendance is required to get the certificate. Okay, so it is 2-month course, so it will end on July. Okay, so this is all about the basic details for this course, right? So if you have any query, so you can ask me or the following classes. Okay, okay. Okay, so today I am just introduce about the concept of counseling, right? So you need to just understood what is counseling and what are the techniques of the counseling. So today's class is on introduction of counseling, and the study material will be provided to you. Okay, after the classes, right? So today's discussion point is what is tele-mental health counseling and what are the benefits of tele-mental health counseling, what is counseling, goals of counseling, and the characteristics of counselor, right? Okay. So if you have any query, just you need to unmute yourself and ask me your questions, or you can write your query in chat box also. Okay, so let's start. Okay, so tele-mental health counseling refers to the provision of counseling service using telecommunication technologies, including like emails, text messaging, video conferencing, phone calls, right? So tele-mental health is the use of telecommunication or video conferencing technology to provide mental health services. So as the need for providing virtual mental care services has increased, providers are finding ways to use phone, video conferencing technology to bring therapy, evaluation, intervention, and medication uh, management to individual where they are. Okay, so and the practice and the Dr. Um, Orpita Chatterjee have joined the session. Welcome, Orpita Chatterjee, Dr. Orpita Chatterjee. Okay, so continue. Let me continue. Okay, so I'm saying that tele-mental health counseling is particularly salient in times as the COVID-19 pandemic, when accesses to in-person and the stress levels may be high. Okay, so this practice has become much more common as a result of home confinement due to COVID-19. Right. So you all know that our finance minister, respected Nirmala Sitharaman, while presenting the budget 2020 to 2023, said that the telemental health counseling program will be launched to improve accesses to quality mental health counseling and care services, which will be consist of digital methods to improve mental health condition and facilities. So it will cover the remote area, and it will help the person attend immediate sessions. So it will help them to enhance their mental resources by attending the telemental health counseling session, right? So, sorry. Okay, so coming to what are the sorry, my device is not working suddenly. Sorry. Okay, so let me continue. Okay, now coming to the benefits of telemental health counseling. So what are the benefits are? Telemental health appointments, firstly, do not require travel and often mean less time of work and smoother logistic coordination for things like transportation, childcare. And the uh, telemental health counseling session can be, the appointments can be scheduled at more flexible hours, and counselor may available for people to access services in a remote area and emergency situation. And for those who may have hesitated to look for mental health care in past, telemental health services might be an easier first step than traditional mental health services. Okay, so this service may offered stand alone or in conjunction with in-person therapy, right?
Yes,
So coming to what is counseling, right? So counseling, because you will be a telemental health counselor, right? So you need to know the basic concept about the about the counseling first. So the counseling in 1997, the Governing Council of American Counseling Association accepted the following definition. So let me read the definition for you. So counseling is an application of mental health, psychological, human developmental principle through cognitive, affective, behavioral, or systematic intervention. So why it is called cognitive, affective, behavioral? Because in psychology is devoted to study three aspects. If you can You just need to remember A, B, C. A refers for affective, B refers for behavioral, C refers for cognitive. So psychology is studying three fields: affective, A for affective, B for behavioral, and C for cognitive, because they have interrelations with each other. Because our cognitive means it's a mental process, right? So how we analyze the situation. Okay, so analyzing the situation affect our thought, and simultaneously thoughts affecting our affect, our emotions, and our behavior. Because situation is an external part. We cannot change the situation, but situation may trigger our thought. But trigger it can influence our thought in a negative way and positive way. But it is depend upon us how to evaluate that situation. Right. So situation, we can evaluate the situation with using some distorted mechanism, like we can analyze the situation for in a faulty way. So our thought become negative, and the negative thought will influence our emotions, so that emotion become negative, and negative thought will also affect our behavior. So behavior also will become maladaptive. So if we analyze the situation in a positive way, right? So so we can adjust the negative situation in an adaptable manner. So we will not very much triggered by the situation. Okay, we can process our thought in a positive way. So our affect will be positive, and we behave in an adaptive way. Right. So counseling is using those principles to intervene our cognitive and affective and behavioral systems. So the strategies that address wellness, personal growth, and career development, as well as pathology. So understood? If you have any question, then you can ask. Okay. Moving on. So counseling actually deals with wellness, personal growth, career, pathological concern. So in other words, counselor work in areas that involves relationship, and these are include intra and interpersonal concern related to finding meaning and adjustment in such setting as family, workplace, career, and schools. Right. So counseling is conducted with persons who are considered to be functioning well, and those who are having more serious problems. So counseling meets the needs of a wide spectrum of people. Okay. So counseling, that is a kind of a process that may be developmental or the intervening the client. Okay. So this is all about the basic introductory knowledge about counseling, right? So I would like to ask participants, what is your viewpoint about the counseling? Okay, so present participants, would you want to tell something about your understanding about counseling? Shudipta Mojumdar? Darsh?
Ma'am, counseling is actually an opportunity to talk with a professionally trained counselor so that he could guide us, support us, and gives us a new perspective on our issues.
Very good, very good. Okay. Other participant? So Ms. Mojumdar, you are studying psychology in MA. So do you want to reflect some your viewpoint?
Yes, ma'am, I am.
Yeah.
For me, counseling is the process that one can help some other people to work positively and the thought positively, effectively, and interact with their environment effectively.
Nice, nice, very good, nice. Priyanka Devnath?
Yes, ma'am. Actually, counseling helps one person who is suffering from some psychological issues, help them understand how can they react, not react in a situation, um, but respond only.
Okay, very nice. Dr. Orpita Chatterjee, would you like to say something?
Yes, ma'am. Am I audible properly, ma'am?
Yes, you are audible.
Actually, I'm facing heavy network issues. So, ma'am, I'm not my background is not psychology or anything else like that. I'm a layman in this field. But to me, I understand counseling is nothing but a sharing of mental feelings and to upgrade one person from their mental status to a betterment way in sharing in various way to to open up to and to share what can I say to for the betterment of any person towards for a healing purpose. Is it, ma'am? Am I
Yes,
right?
yes. Very good, very good. Yes. So thank you.
I'm facing a very bad network issues, and so sometimes it is not possible for me to talk today. Sorry
Okay,
for that.
no issues, no issues. Okay. Okay, moving on. So, so now we will discuss about some goals of counseling, right? So first goal of the counseling is to generate insight. Okay, so it is like that. The insight means the acquisition of understanding of the origin and development of emotional difficulties, leading to an increased capacity to take rational control over feeling and action. Okay, and so insight generation is very important because the patient need to understand about their maladaptive behavior, about their maladaptive thoughts and their negative emotion, because if they generate their insight, it will be easier for them to rectify their thoughts, to rectify their maladaptive behavior and their emotions, also to alter their emotions. Okay, so next is relating to others. So relating to others, here we can say that uh, becoming better able to form and maintain meaningful and satisfying relationship with other people. For example, within the family, within the workplace, with friends, and with many significant persons, because we are a sociable person, right? So we need to adjust with our situation adaptively. So sometimes we have some communication problem because we sometimes evaluate the situation negatively, evaluate the person negatively, and we are using some distortion mechanism. So that's why we are evaluating the situation uh, opposite manner, right? So that's why we become we cannot adjust with the situations and others. So relating with others enable the patient to relate with others, so they can adjust with their situation, their surroundings meaningfully, and have satisfying relationship with others. Okay, okay. Next is self-awareness. So self-awareness is that the counselor should make the patient becoming more aware of thoughts and feeling that had been blocked off or denied, or developing a more accurate sense of how self is perceived by others. Okay, so self-awareness help to enable the patient to judge their self with the standards that have been set prior by them or the social society, so they can compare themselves with the standards and can be aware of the situations of their self, right? Okay, next is self-acceptance. So self-acceptance is the development of positive attitudes towards the self, marked by ability to acknowledge areas of experiences that had been the subject of self-criticism and rejection. Because if we see the depressed patient, you can see that while talking with them, you can see that you can notice that the depressed patient may have low self-esteem. Okay, they are creating very negative evaluation about themselves. They feel that they are very worthless, they will not do anything properly. Okay, so they are constantly creating negative things about themselves, right? So the counselor will help them to identify positive things about themselves and create positive attitudes towards self, so they can, because making negative sense about self will not help you to achieve your desire. Your motivation will low, right? So we as a counselor, it is our motive to enhance the resources that people have within them. So self acceptance, and generating self-acceptance in a positive way, help the subject, help the patient to modify their negative thoughts about themselves, right? So they will we can advise them to stop making critical comment about themselves, stop rejecting their pleasurable activities, because pleasurable activities make the patient, will make the client uplift their mood, right? So we should motivate the client to accept their positive side of the self, not only maximize, not only highlight their negative side of the self. Okay, so this is all about this point. Next is enlightenment, right? So enlightenment is that uh, like by doing self, making the person aware of their self, accepting the positive and negative side of the self, so it may help the client to move in the direction of fulfilling the potential or achieving an integration of previously conflicting part of itself. So we as a counselor can assist the client to arrive at a higher state of spiritual awakening state, right? So they can pursue their own goals, they can enhance their own motives, and they can flourish and actualize their self where they are. Okay, so this is, and the next is problem solving, right? So find we human being have many problems. Why the problems are creating? Because we are facing sometimes conflict. Sometimes we want to approach some needs, and sometimes we want to avoid those needs. Or sometimes we have two needs, and simultaneously we have two needs, but we want to avoid those needs. But there is a chance, there is a circumstances that we have to choose one need at a time, right? Like you want to buy a cloth and you want to eat ice cream, but your mother will not allow, mother said you that you can choose one thing at a time, either cloth you can get, or you can have your own ice cream, right? So that time you will be very you are in a conflicting situations. So you will be facing this, you will be thinking this is very problematic situation to you, right? So this conflicts may arise some problem in yourself, in your mind, not self, in your mind, right? So finding a solution which is more important to you at this moment. So doing some judgment, like in a advantage and disadvantage manner. So finding a solution to a specific problem that client had not been able to resolve alone, right? So we counselor help them, help the client to acquire a general competence in problem solving approach. So they can, counseling actually enable the patient to be a independent, not to be dependent on others, right? So to be a independent, we should competent to solve our problem in our own way, in a positive way, in an adaptive way. So counselors should teach, should train, should mm, should teach, should train, should help the patient to acquire general competence in problem solving approach, right? So next is on acquisition of social skills. So already I said in the second point that relating with others is very essential thing for us, right? So acquisition of social skill, that we can say that learning and mastering social and interpersonal skills such as maintenance of eye contact, tone taking in conversation, and turn taking in conversation, assertiveness or anger control. Because sometimes we get into a conflict, and sometimes people get into conflict and show aggressive behavior towards others. So anger, it's not a very adaptive behavior, because anger convey negative things about ourselves to others, right? So anger is a very negative emotion, right? So excessively expressing anger is not an adaptable thing. Okay, so sometimes the patient who may come to you who have issues of anger outburst, throwing languages to others, right? So that time we as a counselor advise need to train our patient how to control their expression, how to control their way of talking, how to manage, not control, how to manage their way of talking, their conversation skill, their communication skill, right? So if we continuously express our anger, our aggressive behavior towards the other people will not accept yourself, other people will not see your positive side, right? So it is the main essential part, how to train, how to train the patient, how to acquire social skill, how to deal in an assertive way in a situation. Assertive means not being so critical and not being so submissive. Okay, so you can say your opinion very straight and non-critical way. Okay, I'm not saying that you should accept all the situation that is against you, but you can say it non-critical way. Okay, so we should train our clients who have aggressive outbursts, who have some maladaptive social skill in this way, how to communicate with others. Even sometime you will, while taking case history of your clients, you will see that some families have their maladaptive conversation skill, right? So then we should enhance, we should teach, we should train the positive, assertive communication skill to the family and the client, right? So this is the way how to teach, how this is the goal. This is the goal of the counseling, to help the client acquire social skill, to deal adaptively with their situation. Okay, so that they can sustain their interpersonal relationship in a good way. Okay, next is cognitive change and behavior change. So while I am discussing about the definition of counseling, I already mentioned that our thoughts and actually influence our behavior, our emotion. So in some, when you will be uh, taught about the models, you will see the cognitive models, you will see, you will be taught that our behavior, our negative thinking actually influence our behavior and emotion. Aaron Beck, who developed cognitive behavioral model, who he said that a cognitive behavior model, Aaron Beck said that if the person analyze the situation with cognitive distortion, like if we uh, as I said before, the situation is not my under control. These are the external part. We cannot change the situation in our own way. We cannot predict this. We can predict, but we cannot change. We cannot create the situation in our own way, in our own desire. Right? Situations are going on in their way. Right? You cannot control other people. You cannot control your environment. But what can you control? Your thought, your interpretation strategy, your appraisal strategy. You can control that. You can modify that. You can control your behavior. You can control. You can regulate your emotions. That is the ability you have. But you do not have the ability to change the situation. Right. So sometimes patient like depressive patient, anxiety patients come to you, and while taking the case history, you can see that the person is analyzing their surrounding in a very distorted way. Okay, situation in a very distorted way. So they distorted way in the sense they purposely maximizing the negative situation and minimizing the positive aspects of the situation, and maximizing the negative situation, and the product of the maximization, they are generalizing the outcome every situation. Overgeneralization, that is called. They are overgeneralizing the situation. Okay, and they start labeling themselves as very negative person, very bad person, very worthless person. They start labeling themselves. Okay, then having this kind of negative thought, the thought may influence your behavior. You will delay your task, you will behave very maladaptively, you will feel retarded, you will get dissatisfied with your performance, right? So your emotion and behavior will be affected by your negative thought. Your means the patient's negative thought, right? So as a counselor, it is the responsibility to modify and replace the irrational thought, irrational belief, maladaptive belief, maladaptive belief in a positive thought, into a positive thought. Okay, and modifying the maladaptive behavior, because sometimes you will see patients are showing some self-destructive pattern of behavior. Okay, self-destructing pattern of behavior, self-harm behavior, right? So as a counselor, we should train our patient to modify those maladaptive behavior and irrational behavior, right? Okay, next is empowerment. So empowerment is that it is empowering the client, working on skills, awareness, and knowledge that will enable the client to control of his or her own life. How it can be done? By that, what I'm saying, that by reducing their conflict, about how can reduce their conflict. They can be more aware of about their self. They can be more aware about their situation, about their surrounding, and they if enable our clients to solve their problem very adaptive manner, and we help our clients to acquire the positive social skills and modify their cognitive and behavioral strategy, maladaptive cognitive and behavioral strategies, so they can gain skills and knowledge that help them to control their own behavior, thought, and emotion, so they can empower themselves, right? So this is a very systematic change, introducing change into a way in that social system, like in a families, to operate. Okay, so here we can also psychoeducate the client and their families to acquire their ideas and techniques with which to understand and control their fears. Psychoeducation, very important part. Psychoeducate about their maladaptive communication style, about their maladaptive thought. Psychoeducation is very important. Okay, so psychoeducation help our clients to acquire the positive idea, to adaptive idea and adaptive technique, which should be understood by them and which may help to control their behavior, modify their thought and regulate their emotion. Okay, so you all get my points.
Yes, ma'am.
Okay, okay. So these are the goals of counseling. Next, coming to characteristics of the counseling. So this is very important, right? Characteristics is we should have we should maintain some decorum, some characteristics of personal features as a counselor to make our session rapport establishment. Rapport establishment like counseling relationship. The relationship between a counselor and client is a kind of a feeling and attitude, that client and therapists have towards one another, and the manner in which those feeling and attitudes are expressed. Right. So this attitudes of counselor towards her clients and the relationship between counselor and clients is very essential for make the counseling session very fruitful, very positive, very better. We will get better outcome. Okay. So what will be the basic characteristics of the counselor? Several skills need to be brought into counseling session, but this includes firstly attitude skills. Okay, attitude of the counselor towards their client, right? So attitudes can be positive and can be negative. Okay, there is a probably nothing which has greater impact on the outcome of a counseling session than counselor's attitude, right? So this includes first is respect for oneself as well as respect for the client. Okay, so how we can express our respect? We can express respect by praising the client's individuality and structuring the counseling to the needs, capacities and the resources of the individual. Sometimes the counselor assign some homework to the client. So if our clients do their homework very positively, right, and if they communicate with their parents after psychoeducating about the communication skill, if they communicating with their families, with friends in a very positive way, so we as a counselor should express we should praise our clients about doing this good things. So respect is very essential. We should respect our clients. We should. Okay. Next is genuineness. So genuineness means it's like congruence. Congruence like it is a consistency of or harmony between the counselors says that what is what he or she is. Like this condition reflects honesty, trust, and trust also. So we should we should be genuine as a counselor, right? So this is, and we should be unconditional, and we should be express our positive regard, which makes your client, which makes our clients feel welcomed and valued as individual. Okay. Next is very essential, very much essential, that is empathy. So you as a counselor, we should be empathic to our clients, very much essential thing, because it is empathy is the ability to understand what is the client experiences and to communicate this kind of feeling. Okay, so I just want to mention that Carl Roger 1980, Carl Roger 1980, who is known for client-centered therapy, and you will also be you will also teach about his model. So Carl Roger defined it as a perceiving the internal framework of preferences of another person. Okay, so we should empathize our patient. We should understand the perspective from the patient side. We should not be very egocentric. Okay, so we should be empathize our patient, our client, so that we can help them, we can understand their resources. Accordingly we can help them how to use their resources to deal with their situation. Okay, and empathizing your client also make your clients feel welcome and valued as an individual, because sometimes the clients who are very depressed, who are very anxious, may not feel comfortable to discuss their problem with their families, with their friends, so they are coming to you to find solution. So sometimes you can see, because there are some stigma that if you feel sad, if you skipping your classes, your works, so society will judge you. Society will judge you in very negative way, right? So uh, so being a counselor, we should not be labelized our patient, our client. Okay, so they are coming to you to get a solution. So we should be unconditional. We should be show empathy. That's why they may feel very welcomed and valued as an individual to you. Okay, and then that may help to enhance their self-esteem, the positive value of their self. That is very important. That is very important. Sometimes a depressive patient and depressed patient may not value their self. That's why sometimes they think some negative things about their future, about their life. Okay, so we should, I'm repeating these things, we should be empathetic and we should be unconditional and genuine towards our clients, so they can value their self in a positive way. It is very important. Okay, so this attitude should be maintained, you should be maintained by you all while you are taking your case history, your mental status examination, right? So it is very helpful. Okay, next is listening skill. So listening to client is not just a matter of receiving what they are saying to you, but also receiving how they say it. So you should notice their non-verbal communication pattern also, their facial expression, their body gestures, their mannerism. You also notice them also, not only just listen what they are saying, right? So being a good listener entails receiving and sending appropriate messages. Listening to client is not, sometimes how they communicate is much more revealing that what they actually say, which may be more concealing than revealing. Okay, so listening skill is a basic to all human interaction, whether the purpose is for getting information, conducting depth interviews, because while taking case history you will also be trained about the how to take case history. While taking case history, you should maintain a depth interview process. You should allow an open discussion. You should allow the patient what they are want to say, even uh, in a morbid condition or in a pre-morbid condition. What are the difference are there? You should be evaluate. You should be elicit from your patient and your family members and the patient's caregiver also. So depth interview is very important because it may help you to formulate about what is how the pathology is emerging. So detailed interview, listening skill, this eliciting the information, receiving the information, receiving the appropriate message by your patient and their family members is very important. Okay, so listening is considered to be most important counseling skill, most important, right? Okay, next is verbal communication. Verbal communication skill. So verbal communication skill uh, is the use of words in counseling is a skill which requires many practice. Okay, many practice, because if the use of words in counseling skill in which like in other skill requires very practice, because what because it is very important to establish rapport with your client. Rapport is very important, because if we build a good rapport with your client, then client will trust you. Client and rapport, how positive rapport you, if you build a positive rapport with your client, then the client may trust you. Client have a faith about the counseling process, may generate hope about the counseling process. Okay, so this is very important. What kind of language, what kind of vocabulary you are using. If inappropriate vocabulary is used, rapport and understanding will be hindered. And when this happens, miscommunications occurs. Right. So counselor must be sensitive to both the literal and emotional phase of verbal communication, vocal interaction. Right. So we should be aware of our tone. We should be aware of our reactivity also. Right. So counselors should maintain this characteristic. Lastly, the giving leads. Giving leads provide support to you, provide support and understanding of different behavior. Okay, so leads may be defined as a statement that counselor use in communication with the client. So some like how it can be done, like you can reward or reinforce your agent, or you can it is often used to support clients exploration of ideas and feeling, or test different behaviors. Okay, reflect your understanding, because reflection of your understanding, and if you communicate your understanding, then client will feel that was understood by this counselor in a very positive way. Or you can interpret what the client's statement actually means. Okay, and you can communicate this with your client also. Okay, so also you can repeat what the client is saying, or paraphrasing your understanding while communicating your clients. Right. So these are the basic characteristics should be maintained by a counselor. If you are doing offline, or if you are doing online, like telecommunication pattern, you should be maintain a positive attitude. You should listen your client very very positive way. You should be use you should be maintain positive verbal communication and give leads to your clients, right? So these are the basic characteristics of for being a counselor, right? So these are all understood by all of you. Would you like to reflect your ideas? Okay. Okay. Okay, let me conclude this. Hello, yes, Orpita Chatterjee. Hello. Sir, would you like to add something? Sir, are you there?
Hello, just I finished my telecounseling.
Okay.
Yeah, just now I have finished my telecounseling, so I was busy there. But I am following you as much as I can. So whether the students they have understood, Dash, Priyanka, Sudipta, whether you have understood?
Yes, sir. Yes, sir.
Yes, sir.
So what's the difference between the general counseling and the telecounseling? Abhishek?
So actually, I'm joining in just 15 minutes, sir. I'm late today.
Okay.
Hello. So what's the difference between the two? And is there any advantage of the telecounseling?
Yes, sir. Advantage is there because sometimes we face that client doesn't open up in front of us, but when we talk over the telephone, they cry, and the emotion they show.
Yes, Priyanka, I think you are talking something.
Hello.
Priyanka, please.
Yeah. And network issue, sir. Am I audible, sir?
Yeah, you are audible.
Yes, you are audible.
And they face some problems when they come in front of us in our clinic, but when they talk over telephone, they easily can cry from their home. And may you talk in Bengali, ma'am?
Yeah,
Yes.
no problem. No
No
problem.
problem. Yes.
আচ্ছা আচ্ছা, থ্যাংক ইউ স্যার, থ্যাংক ইউ ম্যাম। যখন স্যার আমরা দেখি যে আমাদের কাছে যখন পেশেন্টরা আসে, অনেক সময় তারা ওপেন আপ করতে চায় না। তাদের যে এক্সপ্রেশন যেটা, সেটা ভাবে যে আমার এক্সপ্রেশনটা আমি আমার ডাক্তারবাবুর কাছে শেয়ার করব, বা আমার যে কাউন্সিলিং করছে তাকে শেয়ার করব। মানে তারা এতটাই ভেতরে যন্ত্রণা নিয়ে বেঁচে থাকে যে তারা কখনো বলতেও পারে না যে এই বলাটাও যে তাদের মধ্যে একটা স্বাধীনতা, বা এটা যে তার অধিকারের মধ্যে পড়ে নিজের ইমোশন গুলোকে এক্সপ্রেস করা, সেটা তারা বুঝতেই পারে না যে আমি এটা আমার ডাক্তারবাবুর কাছে বলবো কি বলবো না। তো এটা একটা অ্যাডভান্টেজ যে যখন টেলিকাউন্সিলিং এর মাধ্যমে ডাক্তারও বা কাউন্সিলিং যিনি করছেন তিনি পেশেন্টকে দেখতে পাচ্ছেন না, এবং পেশেন্টও ডাক্তারবাবুকে দেখতে পাচ্ছেন না। ফলত হয় যে অনেকটা বন্ধুর কাছে শেয়ার করতে গেলে যে জিনিসটা হয়, যে ফিলিংসটা হয়, সেই জিনিসটা অনেক সময় হয় যে পেশেন্ট সেটা ফিল করে, আর সেটা একটা অ্যাডভান্টেজ স্যার, এটা আমার মনে হয়। কারণ আমি বন্ধুদের মধ্যে অনেক সময় এই কাউন্সিলিং এর এই ব্যাপারটা আমি করে থাকি, মানে এটা আমার ভালো লাগে বলে। তো এটা দেখেছি যে অনেক সময় বন্ধুরা যেটা আমার কাছে ওপেন আপ করতে পারে না সামনে এসে, সেটা ওভার টেলিফোন হয়তো রাত্রেবেলা বললো, পরের দিন আমাকে দেখে বললো তোর কাছে এত কথা আমি কি করে শেয়ার করলাম, এটা আমি কোনোদিনও তো কাউকে বলিনি, হয়তো ফোনে বলেই বলতে পেরেছি। তো এইটা একটা অ্যাডভান্টেজ আমার মনে হয় স্যার। থ্যাংক ইউ স্যার, থ্যাংক ইউ ম্যাম।
Very nicely, very nicely. Shreyoshi, please
Exactly.
you speak in English so that other students can understand. Shreyoshi, please you translate.
Actually,
Priyanka.
Priyanka Deva, Dr. Priyanka Deva actually trying to say that sometimes patients who are taking offline sessions, sometimes they feel, sometimes they cannot share their opinion, they cannot share their feelings, express their self very readily, cannot share their feelings. But over the phone, over the while taking Tele-Mental health counseling session, the patient can feel more relaxed, more comfortable to share their experience, their emotions, right? So that's what I guess Priyanka Devnath is trying to say. The telemental health counseling makes the patient, makes the client more comfortable to express their feeling, and but while face-to-face session, they feel more uncomfortable and they cannot say their feelings, their emotion, their thoughts. They cannot unable to while doing it face-to-face session, right? Right, Bianca Devnath? I'm
Yes, ma'am. Yes, ma'am. Thank you.
okay. So anyone else?
So, what is the difference between the counselor and the psychotherapist? Can anybody tell me? Or what's the difference between counseling and psychotherapy? Yes, Abhishek, please. Hello, Abhishek. Okay, Darsh, can you tell me what's the difference between counseling and psychotherapy?
So, counseling is used basically used for the normal individuals who have their daily issues, but psychotherapy may be for those who are severely disturbed.
So, Sayoshi, have you taught them? Not IT, huh?
No, I had taught them about the basics of counseling characteristics.
Okay. No problem. No
But
problem.
still, the
Because
because
they
the
have no
sir
idea.
raised this question, I just want to tell in a short way. I will cover this on next class also. The basic difference of counseling and psychotherapy is psycho in-depth manner, very in-depth manner, right? And psychotherapy will do very depth, and they can. And basic difference is that being a therapist, you should be ethically, you should be trained by RCI registered course, and counseling is deal the present situation. Okay, deals only the present situation, and give the counselor may give you the leads and give you the suggestions. Okay, but psychotherapist and not only give you the suggestion, enable you to be a psychotherapist of your own. Okay, they are doing their job very in-depth manner. Okay, so this is the understanding. Sir, would you like to add something?
Yeah, in case of the psychotherapy, it is basically the psychiatric disorders. But for example, schizophrenia, manic depressive, depressive
right.
disorder, MDP, like that. So, but in case of the counseling, not necessarily it will be the psychiatric patient. So, because the consciousness that is relatively better. But in case of the psychotherapy, we will find the cognitive distortion is there, cognitive impairment also there. But in case of the counseling, there is no question of any cognitive impairment. But cognitive distortion, too much cognitive distortion, that is usually we find in case of the psychotic patient or any psychiatric disorder patient we find. So there we can apply the psychotherapeutic principles, psychotherapeutic techniques. For example, in case of the rehabilitation, you can follow the Skinner's principle. Again, you can follow the Skinner's principle in case of the academic management, academic self-confidence, you can do the same thing. So the root basically psychological theories, and you are applying the psychological theories in both counseling and psychotherapy. But in case of the psychotherapy, when it is called the therapy, that is the treatment. And this treatment specifically in case of the any psychiatric disorder, for example, obsessive compulsive disorder or schizophrenia or the paranoid paranoia, many disorders are there. So you will learn everything. A lot of the abnormalities are there basically. And there are many other differences. So please you browse some of the researches. So you will get all those things.
Even
But
I
this is
will
vital,
teach.
because when you are talking about the counseling, and you are supposed to know the counseling and the psychotherapy. Another important issue there is counseling, because most of the counselors they are not dealing with the statistical data. But when you will be the psychological counselor, you are supposed to deal with the statistical data. Here, statistical data is not that the large number of data. It is not like that. It is definitely the individual data, data across the over time. Or so you can collect that data and you can modify the data. The approach is already followed by Professor Skinner, B.F. Skinner. B.F. Skinner has shown us that is how to deal with the data for counseling. Yeah, no, it is over to Sriyoshi.
Okay. So for now, conclude the today's thing. Once again. Okay, so what I have taught you that counseling is a process by means of which the helpers empathy towards the person with a mental health problem and facilitates the person's personal growth, right? So personal growth is the main thing, main motto of the counseling, right? So the Tele-Mental Health Counseling course from our institute, Pravindik Psychotherapy Research Institute Trust, may offer a set of skill development and development course under the academic assistance. Okay, so following classes, you will be taught about the process of the counseling, various model of the psychotherapies. Okay, how to assess the person with depression, anxiety, how to assess the children with their mental health problem. So this will be covered following the classes. And so our motive is to enrich the resources for Tele-Mental Health Counseling program. Our motive is to enhance the resources that you all can assess the clients with anxiety, depression, and any childhood related emotional distress, and intervene them with very adaptively. Right. So this 2-month training on Tele-Mental Health Counseling program may help you, the professional, the budding professional you are, to identify these policies within professional codes of ethics and possibilities of Tele-Mental Health practices. Okay. So start preparing yourself about this idea of the counseling and start read yourself about the counseling. You should review some literatures about the Tele-Mental Health counseling, about the counseling process, how counseling affect on any mental health disorders, how counseling affect children with emotional distress, right? You should also prepare yourself. You should also study some literatures about counseling and how, because Tele-Mental Health counseling is very, it is very recent new approach. We are using we are using every day, right? Because as I mentioned while starting the class, that now the pandemic situation is unable the persons to go to their chambers and clinic and make the face-to-face online session, right? So you should also read the Tele-Mental Health counseling, how the Tele-Mental Health counseling affect any disorder, any psychiatric disorder, how it may help the patient with any psychiatric disorder to develop their own resources, their personal growth. Okay, so you should also review. You should also review some literatures. You will get very other. If you just need to search some literatures, right? Okay, and you will get the results. So next class, we should move forward about the process of the counseling, and I just want to hear something what you have learned, what you have searched about the effect of telemental health counseling. Okay. Hello.
Dr. Orpita Chatterjee is here. So,
আওয়াজ হচ্ছে স্যার
আওয়াজ হচ্ছে
হ্যাঁ স্যার আপনি
Yes. So you can talk to Dr. Orpita Chatterjee. She is also here.
Orpita Chatterjee, Dr. Orpita Chatterjee, would you like to say something?
Oh, her microphone not added.
She's
Okay. Okay. So may I close it?
Yes, sir. So participant, you have understand today's class. Today's if you have any queries.
No, ma'am.
No. Darsh, Priyanka Devnath.
No, ma'am. No, ma'am. Today's introductory class is fine. Yes, ma'am.
Okay. Okay, then we can end our class here.
Then please put your hand for the prayer. Om Purnamada Purnamidam Purna Purnamudachyate Purnasya Purnamadaya Purnameva Bhushishyate Om Shanti. Okay, thank you. Good night. Best wishes to all of you.
Thank you, sir.
Thank you, sir.
Thank you, ma'am.
Thank you.